Compromise their treatment? How does that compromise their care, or does it?
Well, if I was critically ill, I wouldn't want to be getting on a plane and flying to Halifax.
I guess the thing too is the expectations for what sort of a care that you're expecting is going to be different from a community hospital that it is in a hospital that's billed as a tertiary hospital. You know, if you show up in Clarenville or some community where there isn't a pediatric intensive care unit as such, you may expect that if your kid is sick enough, then they will be flown to another institution. But as a tertiary level pediatric hospital, the expectation is rightly there that those kids should be able to be cared for at that hospital. And, you know, a lot of times those kids that we see that are very sick are very unstable. And, you know, we've had kids that are so unstable that they actually spend more time in our emergency department because they're too stable to move down the hallway and up the elevator up to the intensive care unit. They're so unstable that even moving them to ICU or to the CAT scanner, people think long and hard about whether the kid is actually stable enough to move even within the hospital. And just contemplating moving those same children and flying them to another hospital, is, say in Halifax or in some other city outside of the province, is just, there are so many problems inherent with that, and it's just not the same level of care at all. And it's certainly not the level of care that people might expect. It's something that you do as a necessity if you're in a place that doesn't have the care, but it's certainly not an ideal situation to have to transport a patient like that.
Personally, I get maybe 4 to 6 calls a month from other centres such as Buren, Carbonear, Placentia. Mostly the east of Gander, I'll get a call about a patient that could potentially end up in our intensive care. If we don't have a fully functional intensive care unit, I don't know what I'm going to do with those calls.
What kind of message would it send about healthcare in the province if the flagship hospital in the provincial capital can't run a pediatric ICU?
Not a very good one.
How do you think it would be perceived by other doctors and other centres? I mean, Eastern Health is out trying to recruit now. How do you think it would be perceived by other people in this specialty or in your specialty if they're looking at coming to work here?
It would be perceived, obviously in a negative light in terms of potential, physician recruitment for one. If I was going to work in an emergency department in another centre, I wouldn't want to work anywhere that didn't have a fully functional intensive care behind me. I've done years in rural hospitals. I've worked in Carbonear Hospital for 2 years. And it makes it much more difficult when you're working in a hospital as an emergency physician when you don't have a full backup. It doesn't make it impossible. I've done it, but you're a different institution when you're working, say, in Carbonear, and they do great work, or when you're working in Buren. But it's not the same as working in a tertiary care referral centre. And that needs a fully functional ICU.
What do you think of the chances that Eastern Health could recruit doctors to fill the positions here? They talked about doing that as if they'll have no problem getting doctors to come here. And we've heard...
Well, there's been two intensivists here for the last, I think, 10 years. And I think I'm not sure, but they've wanted to have more than 2 for the last 10 years. And they've never been able to retain for the last 10 years. So chances are probably not good given the environment right now. Not saying that can change, but...
The workload issues, it's my understanding, and we've been told that before, that the workload is a deterrent too.
The workload in terms, again, we don't work in intensive care, so we can't. I can't comment on the workload when they're there. I can't compare it to my work, but I just know that being on call 1 and 2 is just. I mean, no young physician who's just finished any residency program is going to entertain that possibility. I can't see it happening.
If this doesn't get resolved, do you think there will be other doctors like yourself that might opt at looking at going elsewhere?
It's possible. It's possible. But the physicians who now, I mean, Dr. Reid, for example, she's been here for 20 years. She's been doing 1-in-1 call for a while, or 1-in-2 call. She's obviously dedicated. So is Dr. Barter, dedicated to what they do. And it's not about the money for them, because if it was, I feel they would have been gone a long time ago. So we have the dedication. We have physicians here who want to be here, who want to help the people of Newfoundland and help the children of Newfoundland specifically. But in order to make everybody's lives better, things have to improve.
Too about the liability when you talked about needing the intensive care specialists here when you have a really sick child. Are you worried about liability and how it might fall on the doctors there?
Well, I mean, we try not to function always worried about liability. That's not something in my experience. I don't in the back of my mind, I don't worry about liability. We do what we can do with the resources that we have available to us.
Dr. Marshall, your family's got some ins with the boss for at least the next 4 or 5 days. Are you going to make any kind of personal intervention or a plea
No.
to Danny Williams on this?
This is not a personal thing, and it's not something, I mean, I've like I said, I've been here for 20 years. I've gone through negotiation processes as a member of the Medical Association before, and I've never involved personal pleas up to now, and I won't start now. I mean, I feel confident that things will improve and things will get done. It always has in the past, and it's just always a bit of a rough road when we're getting there.
I know it's a secret ballot, but will you be voting against the government's offer?
It's a secret ballot.
Doesn't sound like you're a big fan, though, the fact that you're having a news conference here to criticize what's going on.
I don't know if I'm being critical. I think these are more of, yes, I am being critical. This is more just to make people aware of how we feel, how emotional and how important it is to us to have a fully functional hospital and a fully functional intensive care unit. Because we're proud of the work we do. You know, I like the work I do. I wouldn't have been doing it for 20 years here at the Janeway. But I don't know if I'll be able to do the same work without the backup that we need.
Are you hopeful that the coming change in political leadership will change the way the government is approaching to negotiating with doctors?
I don't think it's going to change at all. I think I think negotiation is negotiation, and I don't want that to be perceived as we have as a negative of our negotiations. This is the way negotiations have been for the 20 years I've been a physician here in Newfoundland.
I think in answer to your question regarding support or not support for the offer that's made to the physicians, I think that one of the things this whole situation has done is that it's reinforced among physicians how interconnected we are in terms of delivering care. And if there's a shortage of specialists, then that's a problem for family doctors. If there's a shortage of family doctors, it's a problem for the specialists. And a shortage in any of those areas is an issue for us as emergency physicians. And personally, I think that very few physicians are going to look at this offer and say, well, this is something that's good for me personally, so I'm going to accept it. I think people are realizing that, the situation that other people are in, other physicians, has a direct effect on their ability to do their job and provide care. I've worked in family medicine in rural Newfoundland, and I know when there's a shortage of specialists, how difficult the situation can be and how much time it takes to deal with that situation. And the issue with ICU is just one group of physicians that has an impact on our practice, and in a way it's the most important one, I guess, because it really destroys the Janeway as a tertiary care hospital if that service is not available. But there are other areas as well, and two of the physicians who have tendered their resignations are doctors who deal with kids with diabetes. And right now at the Janeway, well, in Newfoundland and Labrador, if you have a child who's got diabetic, you can call the Janeway at any time, day or night, and you can speak to a specialist physician who looks after children with diabetes. And we have a very high incidence of diabetes. We have a lot of children who are on insulin pumps, and those kids are prone to complications if they're not looked after very well. And the fact that those physicians are available to provide that service, and it's a great service if you're a parent of a child with diabetes, the fact that they're available to do that takes a huge load off the emergency department. None of those children show up in the emergency department unless it's a true emergency. And if those physicians weren't available, then we would see more kids with complications from diabetes, and we'd probably see more kids show up with ketoacidosis, which is a life-threatening complication from diabetes, and those patients would end up in our intensive care unit. And so that's something that those physicians do. It's behind the scenes, nobody sees it, but it's a huge benefit to those children who have diabetes. And indirectly, it's a benefit to the emergency department because it allows those problems to be looked after outside of the emergency department, which is a much better situation. So we are dependent upon these other services being very healthy and functioning very well. And if there's an unhealthy pediatric intensive care unit because of staff shortages, that has a direct effect on us in the emergency department.
So the emergency room at the Janeway could become clogged up like what we see at the health sciences and at the other hospitals simply because of shortages in other areas, shortage of family doctors, people walk in to emerge, that same sort of trickle effect could happen.
Absolutely.
Oh, we see that now. I know we're going maybe a bit outside the scope of this, but when we see more patients coming in that can't access a family physician because the family physicians are stretched beyond their means as well. So, I mean, it has far-reaching effects. And there's a huge trickle-down effect, like Bob was saying, from the diabetic issue and from the ICU issue.
Thank you very much.
Thank you.
Thank you.